All right, so today is September 1st. It's 1:03 p.m. This is just a work session of the Lake County Board of County Commissioners. We'll have an update today from Public Health and then an update from our library director and talk through some staffing needs that she has identified. So with that, I'm going to go ahead and turn it over to Colleen to give us an update and we'll go from there.
Great, thank you, Kayla. So this is Colleen Nielsen, Director of Lake County Public Health. And the big thing that we are seeing over the last 2 weeks is a decreasing trend in cases. We haven't had an active case since August 21st at this point in time. And so we continue to monitor the cases we have. We continue to push out, education and thanking, everyone for pitching in and doing their part. And we still encourage, all the social distancing practices, including wearing face coverings in public, that we know are making a difference. We have been working on a metrics document that has now been shown at this meeting last week, at a few meetings at this point. And so if everyone's comfortable with us sharing that out publicly, recognizing that it can change to be in alignment with the state. The state is currently soliciting feedback for their metrics document. The big differences between the states and ours is that we have some additional measures that we're looking at as far as indicators, and that includes our hospital capacity, including bed capacity, staffing capacity as well, that may not be captured on a state level document. And so those are just things for us to recognize. The other piece is with the state document, once you move into that next phase, which is protect our neighbors, that the ability to gather in larger groups increases. And at this point in time in our Safer at Home where we are is still at groups of 50, and even moving in protect our neighbor, there might be opportunity to increase that. But the state document will show 500, the ability to gather in groups of 500, which obviously we don't have any venues and or spaces that would support that to safely social distance, because regardless of what phase you're in, all of those social distancing practices and physical distancing pieces are in place. So with that being said, I do have a conversation of, when Lake County is ready to move in to protect our neighbor. At this point in time, we really have 2 weeks of data, and I'd like to see a little bit more data to support that we are truly on, this very low, transmission point, which I just don't know if that's just, representing the last 2 weeks, and or knowing that our kids have gone back to school, that we really want to be mindful not to, loosen anything until we feel confident that the school's in a good rhythm, as well as to ensure that people are staying safe and still following these social distancing practices. We are coming into Labor Day this weekend, and so that becomes the big message of recognizing that folks might be traveling, as well as gathering group sizes, and just be mindful of those social distancing practices. So for me, moving into point and protect our neighbor is probably not something that I would like to look at until possibly mid-September. The state will officially release their metrics from our latest information on September 7th. And from there, I feel like that is where we could kind of start that timeline of, 14 days to see where we're at. Depending on where we start. I mean, right now we are in what we call the green phase, and we can go from there in our metrics. So that is part of the conversation. So if anybody has any questions around that, especially Kayla and or Sarah, about kind of holding where we're at and remaining steady. And obviously behind the scenes, as you guys know, we are working on the pieces that would allow us to shift into protect our neighbor, like a mitigation plan, as well as a contact investigator and tracer plan as well. So, and then just getting some agreements from the hospital, because in the end, the city, county, and the hospital would all need to sign off saying that we feel comfortable, applying, if you will, because that's a piece of it. We have to apply. It's not just an automatic. So that's what I'll say about that. And then I'll, if you guys have any questions, I'll take them, and then I'll talk about a few more things.
Thank you, Colleen. This is Sarah Mudge. I do not have any questions for you. I just want to reiterate and support those points that you made about our capacity and some of those thresholds and numbers that may be coming down from the state. But as you said, we may not have the resources or the spaces to maintain social distancing with some of those numbers. So definitely an important message to continue to communicate throughout the community, as well as the school district opening. So I appreciate that. And is the mitigation plan that you are talking about, because at one point, I think it was that this, and forgive me if it was just us all trying to figure out what, this document that you're talking about now is different than a mitigation plan, correct?
Yes, and so
Yeah.
there was, right, they're both called a mitigation plan, but what we are trying to capture in our Lake County mitigation plan, and Cailee, feel free to jump in, is really capturing everything, all the different pieces, so that it's not just a knee jerk to where we're at, versus now that we have a metrics document, we have the ability to talk about what would happen, to transition between these levels, who should be responsible, who's looking at what. And so to me, it's more of a comprehensive document is what we're working on. We do need that to protect our neighbor, but yes, it's not necessarily like when we had a variance and it was, hey, you went this way, what are you doing right now? Mitigation, versus a much bigger picture, document, which I know Cailee and Josh have been working very hard on, and then getting feedback from, other entities. And then obviously it'll be pushed out to you guys before, it becomes public is where I'm at. Cailee, did you want to share anything on that?
Nope, no additions, just continuing to work on it and keeping it pretty flexible as we potentially change, and definitely awaiting the changes and updates from the state.
Thanks, Cailee. I think that brings me on to the next topic. There was, a few emails that have gone out about extending our disaster declaration. And I think at this point in time, it makes, it is appropriate to do that, with some added language, referencing some of these documents that we now are following and seeing, so that it's not just, redoing the disaster declaration. It is also, adding in and, and linking out some of the other pieces that have come to fruition since the last time we had done that. Cailee, anything?
No, I absolutely agree. I think it's worth revisiting, and not only would the community maybe appreciate just getting a heads up that, hey, we are still considered in a state of emergency or disaster, and we will remain here for a bit, as long as we're transitioning in stages, and the state continues to be in one. So I agree with that. And I'm not sure if we have to, what the board would want, if you'd like us to take a look at what was decided in the spring and start making some edits and call out some more of those public health pieces, as Colleen noted. We're happy to do that.
Yeah, I think that would be great. This is Commissioner Magee. That sounds like it makes a lot of sense to add some of those details in there. Just not only to follow our response, but of course for public edification.
I agree. Cailee and Colleen, when you do some of those edits, then what would that look like for us? Would you bring us a new copy to essentially adopt?
Yes. So obviously we'd definitely want your feedback beforehand. So I don't know if we want to try and pick a meeting on the horizon to have that done and have some feedback, and then you guys would officially re-adopt or extend.
Okay. I can send an email to everyone and try to nail down a date and time for us to have a work session specific to that document and the revisions of that document. So I can do that this afternoon. I'll send out a doodle poll to everyone.
Great, thanks.
Great, thanks, guys. I think the next piece that we were going to talk about is, recognizing because we're in a good state as far as low disease transmission, that we have the ability to kind of decrease our meeting times. And so what I had proposed was to just do a public health update at the normally scheduled, BOCC meetings, the first and third Mondays of the month. Obviously, if something changes, we would be, working on, getting a meeting put together. I will continue to check in with Kayla, as needed, weekly, bi-weekly, depending on what's happening. And then we would continue to, push out information on our Facebook page. Obviously, now we have the ability to push out information specifically on our Office of Emergency Management page, webpage. And then Beth, I don't know if you want to speak to that at all, as well as our, weekly community briefing that we send out to folks, and if that's appropriate. But Beth, would you like to talk a little bit more about that?
Thanks, Colleen. Excuse me. Yes, this is Beth. We have gone live with the new OEM website. We will have that mirrored on the new county platform so that there's redirection to the updated information. There are 3 COVID-specific pages on the OEM site, one of which is sort of an all-encompassing overview with the most recent data, testing counts, positivity rates, as well as the town hall videos, the medical updates, et cetera, sort of a clearinghouse for the core community information. There's also a business resources specific page, and then that risk levels indicators page, which will align with the metrics document that you've just been talking about, and will just continue to be updated on an ongoing basis so that people can track there where we stand as a community, and also what that means for them in terms of industry guidance and sort of, daily operations. So we'll continue to roll that out and make sure that that's in front of people, and obviously solicit input on its utility for the larger community.
Thank you, Beth. Any questions for Beth?
Will you integrate a link to that website off of our new website that will go live in the next week, Beth?
Yeah, Kayla, sorry, I sort of glossed over that. That's what I meant by sort of redirecting. So there will be, the basic OEM information, but then the link directly from the county website to the complementary website that OEM maintains. And, rather than having sort of redundant or dual updates, we'll just redirect people who visit the county website to go directly to the OEM website, and then, can highlight the COVID specific pages directly. So we've already talked to Amit about that, and, talked about sort of what he felt the best practices would be to make that useful for site visitors.
Awesome. That answers my question totally. Thank you.
Awesome.
Yeah, and it makes sense as well that, if folks land on public health, that we would also have that, link. So it wouldn't just be found on one place or on one page. It would probably more than likely be, a banner on, OEM, public health, and the front page, if that makes sense.
Great. Commissioner Mutz, do you have any questions on that?
No, I don't. I just want to maybe reiterate for mentioning publicly then that we will likely maintain and go back to the board's regular meetings and regular work session schedule, and not be, we will continue with some of those other reoccurring meetings like recovery or joining unmet needs and others that have been kind of added to a routine schedule. But I just want to be sure that we are on the same page, because we haven't talked through that on a day-to-day, as a day-to-day item. Is that the intention of the board, Commissioner Marcella, to go back to first and third Mondays and second and fourth Tuesdays?
Yep.
Okay.
I think only with the exception of, budget meetings and that type of thing,
Yep.
We'll ease back into that normal operational schedule.
Very good.
I think for me, that's all I have at this point in time. I think it would be helpful if, there's just some thought of, hey, what really is great information to report out? Like, I don't want to, sound redundant, or, hey, we already got that from this resource, and this is really what, we really want to hear from public health. And so that would be just something to think about, so that when we do meet at the next scheduled meeting, which would that be next Tuesday because of the Labor Day holiday, or what day would that be?
Yeah.
Mm-hmm. Yeah, we'll have our next regular meeting next Tuesday.
Colleen, I think as you touched on, just giving an update on trends happening either at the school or other large, areas that are impacting community behavior and the things that we have to think about would be helpful. As far as details on that, I think we can, those maybe are yet to be revealed.
Yeah, I think so. It's like, it's a matter of like, what happens with Labor Day? What happens after, the first 2 weeks of school opening? But I do hear what you're saying, and really recognizing if we're starting to increase, where are we seeing those increases, why, and, how we're, mitigating some of those pieces.
Yeah. Yeah. And I think talking through, at least for the next few weeks until we get something in place, or if it's determined that, any mitigation plan is going to be a continued working document, I think we can also add or be sure to mention, where certain recovery efforts are. I mean, from, the discussions that we've had on public restrooms downtown or outdoor dining in the middle of winter, we can be sure to kind of make mention that those conversations are continuing. And if there's anything significant that we can share, let's be sure to do that.
Yeah, that totally makes sense to me as well, Sarah. I think, it's just a complement of, all of the information and all, all the little pieces as, from the beginning, it's not a simple, flat puzzle. It's a 3D ever-changing puzzle, but I feel like we're in a really good rhythm and good communication happening all the way around, and just having those touch points at the BOCC meetings.
Great. Thank you. Thank you, Cailee. Thank you, Beth.
Yeah, thank you. We appreciate your update.
Thank you, guys.
And we will see you at our next meeting, Colleen.
Okay.
Thank you.
Thank you.
All right, so we will move into a conversation with our library director, Brenna, and her staff, Jennifer, to talk about their staffing needs going into the fall. So Brenna, I'm gonna turn it over to you at this point, and we'll hop in as necessary.
Okay. So Jen and I worked on a document. I just shared the link to it, to the Google document, in case that has a little bit more detail. So just to kind of walk you through, just give you a picture of what's going on right now. So our operating hours: Monday, Wednesday, 1 to 6, Tuesday, Thursday, 10 to 5. We're closed Friday, Saturday, Sunday. We've removed seating. Our computers are open, but the usage is restricted. All meeting rooms are closed. Children's area is open, but seating and such are removed. The restrooms are locked. People have to ask for a key. And then for just kind of the new things that we have, been able to kind of create in response to COVID is curbside and delivery, which was really big, obviously, when the building was closed. And there are still a couple people I'm dropping stuff off to, but most people are coming in to pick up stuff. We have 9 hotspots that are available to the public. We received a $10,000 grant through the state library, but it was from the Institute of Museum and Library Services for $10,000. And so we'll have craft and activity kits and games that will be available to check out. And we're really excited about that. We're going to get Creative Bug, which is which is an online database of craft classes. We've also, and this has been a big one, is doing mobile checkout, and it's called the BiblioBC. It's the book bike. So Sadie, our new staff member, she has been going out into the community, where, like the farmer's market and any kind of like outdoor gathering. She was invited to to the Black Lives Matter teach-in, so things like that. And that has been able to, like for people who are maybe less mobile or not comfortable coming in, this kind of gets access to our, some of our resources. And the digital collections, that's for the local history, and that's been kind of an ongoing project that because we have AJ working on it, we have been able to kind of up that in priority and are moving that along, because we did have the Leadville room closed. We were not allowing researchers to come in for local history. So getting that content online has been really important. And also just trying to put together more research guides for researchers and other things that are going on in the library. So, and then just the general programming, we are trying to do as much programming as we can, and mostly it's online, with the exception of the citizenship class that Stacy is going to do starting in September, but she's limiting it to 4 people. And then they're also doing language exchange, but that's going to be kind of matching up people, just like 2 people, so they can mentor each other with, like somebody learning Spanish and English, and then they can decide whether to do it online or if they feel comfortable meeting in person, since it's just 2. So we were able to do some young adult programming. Sadie hosted a few things in the Ice Palace Park. That was fairly successful, but obviously our ability to do that is going to be limited. We might, we are going to be having some programming in with limited numbers in the AMAX room, and then with with story time and stuff, Jen is working on creating story time kits, and yeah, so that's and we're kind of again just kind of trying new things. Our general anticipated needs, obviously internet is going to be a big one. Computers, huge need, for all the folks that, are going to be, trying to do some work from home or whatever. And, if we do go into a closure again, we are going to try to figure out how to try to keep access to the computers if possible. Homeschool, obviously huge, we've had a huge, as I'm sure you are all well aware, a huge jump in families that are moving to homeschooling. We've already had a bunch of people in the library looking for resources and such to support those efforts. And obviously our programming with the school district, which I'll hand over to Jen here in just a minute so she can talk a little bit more about that in detail. And just the our general outreach. Because the meeting rooms are closed, and also the the message, because like I said, we took out all of the all of the seating, and so we're trying to go out, trying to find opportunities to go out into the community more, because the general message that we're giving our patrons is come in, take care of your business, get your books, and move along. But we also want to, still have a presence in the community, and and still let people know that we are available, for various resources. Our general staffing needs. I have 3 staff members who are parents, one of whom is a single parent. One who has an older child, which is, and we've been able to, we haven't had to adjust her schedule yet. But for 2 folks, they have younger kids, and they, as everybody knows what's going on with the school. So they are working from home the days that their kids are home. So obviously that's fewer people in the library. I lost one full-time person, Tammy, back in May, and then John left in April. And, so we've obviously lost a lot of staff time. One staff member who normally this time of the year increases her hours is unable to do that. So I'm not, I'm not really able to, to increase the operating hours that we have with the staffing that we have. And I am concerned of what would happen if the schools tend to close. So that's the quick overview. Are there any questions? And actually, before we go on, I'm going to hand it over to Jen real quick so she can talk a little bit more about the work with the school district.
Hi, this is Jen. So yeah, typically we have West Park kids come in and do story time during the week. We've talked to West Park, obviously with their really short days that they have, that's not going to be a possibility, but we really still want to work with the school district. So we've been talking with Taylor, who does a lot of the out of school time stuff. So Sadie's going to go over probably once a week, run a book club type thing. We haven't exactly fleshed out what that's going to be yet. Also, she's going to take the book bike over. So those kids that can't necessarily get here still have the opportunity to use our resources. We also bought a whole bunch of books to give away so we can help build those libraries at home of the kids that, might not have that and might depend on the school for that. Also, Sadie is talking about since we're closed on Fridays, having Friday morning open library for a max of 10 teens that they can come in, they can do a book club. She's had a lot of kids really interested in book club. We also thought it would be a great time for a volunteer opportunity. They could do some shelf reading for us. Just general, if we have crafts and things that we need put together, kits, they can probably do that to fulfill some of that volunteer hours that the high schoolers need. And then we're still in talks with West Park. We are open to whatever they are needing. We want to make sure that we're there to support them. Also for me, after school time, they're going to start rolling out some Google Classroom videos. So that would be a great opportunity for us to use some of our STEM that we've got through grants. And we just got another STEM donation today, which we're super excited about. So we can get those things into kids' hands and make sure that they're, have some hands-on learning opportunity, that everything isn't virtual. We want to make sure that they, are moving and acting and, touching things and all kinds of stuff. So I think that's my quick and dirty of what we got going on.
So questions?
So Brenna, I'm looking at your document that you had sent us, and so you have limited hours. Are you planning on increasing hours with increasing staff?
Yeah, that's the plan. That's what I would like to do. So, because right now, just the way that it is, like if people have meetings or, people need to take a day off, it just starts throwing stuff into kind of chaos. But yes, I would like to open up on Friday and at least one weekend day again, but I can't with the staffing that I have right now. Other questions?
And I don't necessarily have any questions. I guess I'm sitting right now feeling like we kind of need to see how this is going to play out with the school, either the staff that might have to we will make accommodations for, and we have a lot. We are drowning in trying to fill gaps across the county. So I'm not, it sounds like you guys are doing an amazing job in filling the programming with what we have, and it's not quite clear to me where we need to fill positions, I guess, or where there are big gaps there without, I don't understand, and I don't think any of us maybe understand what specific requests from the school district maybe are. I mean, that these are just things that need to play out from where I'm sitting in the next couple of months.
Well, I think, yeah, I mean, I think, you know, our staffing is not, you know, completely, you know, it's, our staffing needs are not completely dependent on what we're doing with the school district. I mean, that's just simply one piece of what we're doing. I mean, you know, I lost, you know, a full-time person and a part-time person, which was equivalent to about 60 hours a week. And, you know, and so that, you know, obviously our, you know, our priority is making sure that there is coverage up front. And, you know, and ideally we have, you know, at minimum, you know, 3 people available, you know, that are available for staffing the front area at a time. And that's minimum. I mean, I'd really prefer 4 because sometimes it gets busy. Sometimes there's other projects that people are working on. And, you know, and we did create a schedule for that, you know, so that we do have at least 3, but it's tight. Right? It's like if people, like right now there's, you know, 2 people are out of the mix because we're, you know, because we're in a meeting, and I have another person that's out at lunch, and, you know, and Stacy's going to leave at 2 o'clock because she needs to go pick up her kids. So, you know, and then that's going to, you know, so we then, you know, have fewer people in the building. And then if we want to, I mean, yeah, we've definitely been doing, you know, I'm really proud of what we've been doing, you know, since this, you know, since the spring. And, you know, and we've definitely been doing the best that we can. And, you know, if we want to, you know, continue doing programming, again, that's fewer people that are available for up front. And also, you know, people like Jen, people like Sadie, that's not why they were hired. They were not hired to staff the front. That's why we have the part-time people, you know, to staff the front and to keep the circulation going. But right now, I only have 3 part-time people, you know, working the front, one of which only works 1 day. One who's having difficulties, and I'm not even sure how much longer she's going to last because it's kind of stressful right now working with the public. And, you know, and then there's, you know, AJ, which we're trying to split her time between local history and circulation. And, you know, and that's what one of the people that I lost was John, who, you know, and that's what allowed us to, you know, to be open for the weekends. And, but right now I'm the only one that is able to work on the weekends, which, you know, we have a rule that there's got to be at least 2 people in the building when we're open at once. So right now I can't open on the weekends. So that's kind of where things are at. And we also just need, you know, like I said, if people need days off, if people get sick, it's like, it you know, it can, you know, and other people have meetings planned, like it can throw the, you know, the schedule into chaos very quickly. So, and even before COVID, you know, we were also understaffed, you know, with our circulation staff as well. So this is not new. It's just kind of gotten worse, you know, since losing Tammy and John.
Brenna, have you worked with Lori to develop a job description of what you're looking for?
I mean, I just need someone for circulation, honestly. I mean, that's really all I'm looking for right now is another circulation person. And I already have that job description.
Okay, is that going to be a part-time position or would that be a full-time position?
I mean, it would be great to do a full-time position, but I understand the limitations. If I could, you know, at least get a full-time person, you know, for 25 or, you know, right under 30 hours, because I know that that's kind of the threshold for benefits, you know, that would help tremendously.
Okay. Commissioner Mudge, do you have any additional questions at this point?
I don't. I think that is definitely something that we need to, you know, the board needs to revisit some of these recruitment pieces. So the request, I just want to be clear of the request to include in that conversation is for part-time under 30 hours right now for circulation.
Yeah, I mean,
okay.
yeah, that would be, I mean, if that's, you know, if that's all that I could get right now, then that's all I can get. I mean, like I said, you know, it would be great to, you know, to either have, you know, if I can't, it'd be great to have 2 more people. They don't both, I mean, they don't have to be full-time. Because like I said, right now, you know, it's thin. But if it's, I'll take 1. That's what I can get.
Okay. Okay.
What?
Um,
Go ahead. Go ahead. I'm sorry, Brenna.
That's fine.
I think the next step here would be for us to, or for like you and Commissioner Mudge, because she's your overseeing commissioner, to start that conversation with Lori so that we can understand what we can and can't offer with COVID and staff members being out and that type of thing. Would that be okay with you to have that, to schedule a conversation with the 3 of you to start
Yeah,
that?
of course. Yeah, absolutely.
yeah, and I think Commissioner Marcella, we need to check in with Lori on what the status of all of her recruitment efforts are.
Okay.
I think that would be helpful for me to see where where we're at coming into budget considerations and operation.
Sarah, do you mean, what exactly do you mean by recruitment efforts?
Well, so she has right now on her plate 17 vacant positions.
I see what you mean. I see what you mean. Yeah.
Yeah.
Well, one thing, because we'd actually had so I'd posted John's position literally like a week before COVID, and then obviously that just kind of all went out the window. But what Lori had told me at the time is that if it's a part-time position, then we do the recruitment. She doesn't. She said she only does the recruitment for full-time people unless something's changed. At least that was information that she'd given me. She said I could search it. Oh, go ahead.
Yep. No, that is a conversation that we've had with her to preserve her time and be sure to focus her efforts. So that should remain the same. I think what the board needs to request an update from Lori on the overall status of where that is, and then you and Lori and I can sit down and talk about how we might pursue the process if we decide to award that for you, so that just to consider her time.
Okay.
Yeah.
Okay, that sounds good.
But we'll get that from Lori, and then we will probably, I'll be able to schedule something with you next week.
Okay. That
Yep.
sounds good. Okay, cool.
Awesome. Brenna, do you feel like you got a good path forward?
Yeah. If Sarah and Lori and I are going to meet and hopefully make some decisions, then yeah, that would be great. And
Okay.
and just Sarah, just let me know if there's anything, I can give you, kind of like where I am with my budget and all of that, if you need that as well.
Okay, that's great. And Brenna and Jen, can I ask you just a couple of questions about how things are running? Thank you very much for that full list. Are the hotspots, do those continue to get checked out to individuals, or has there been any strategy in putting those in like community centers or whatnot? I guess I could use an education too on just how far they reach.
Sure. Yeah. So what they are, I don't have one. When we meet next week, I don't know if we're going to do an in-person or online, but I can have one in my hand so I can show it to you. So it actually operates very similar to a cell phone in that, so it gets the signal off of cell towers. And so people can connect, to their laptop or to their phone. And so it's a little different from like a Wi-Fi hotspot. So these are mobile that you can take. So I can give the device to somebody and they can take it home. And so right now our policy is that people can check them out for a week, and then they're not renewable, because we're trying to, and it's all new, and we're trying to make sure that everybody, has the opportunity to get them. And so no, they aren't something that you set up like in a, like in a building and then, so it's not like that. It's really just more for personal use. So, and we're still kind of in the testing phase. Like there's been a little hiccup, a few hiccups here and there. Right now I have 3 available and that have been circulating. And then I, just before this meeting, I got the email that the other 6 should be all set and ready to circulate. So, does that answer your question?
Yeah, no, that's great. And I do appreciate that. And I think others in the community appreciate you trying to push those out to as many users as possible. So thank you.
Yeah.
And then I love that the digital collection is, we're working towards getting that online to kind of free up some of those demands. And forgive me if I missed it. Are you still able to engage with the gentleman who was potentially going to assist?
Oh yeah, he's been helping Andrew.
Right.
He's been helping us through this whole thing, and I was kind of involved in, or not kind of, I was involved in the conversations, but now it's like they're kind of doing, they don't need me, him and Holly meet on their own, and they've made they've made some big leaps and bounds. And again, a big part was because AJ was able to to help with some of the grunt work, so to speak. And but yeah, I think, and I mean there is kind of a mock-up. I don't have the URL with me because it has kind of a funky URL right now. But I can send that to you, and so you can just kind of see where it's going. It looks really, really good. I'm very impressed with Andrew's work, and he's also, because the other piece of this is he's also helping us set up a digital preservation plan as well. So yeah, he's been a tremendous help. So
great. Yeah. And then I am thrilled to see that citizenship class. Is there any talk about either expanding that or offering that?
Yeah. So this
Full Circle, or how is that even getting developed? Can you say more?
So yeah, so Stacy is working. She is working a little bit with Carla from Full Circle, but it's mainly Stacy's thing. And since and she sent out a kind of like a a blast of like, if you're interested, let me know, just so she could kind of gauge what people need. And because there's like a condensed version, like that'll be like 4 or 5 weeks, I can't remember which. And then, or there's one that's like a full 13-week thing. And she was going to try to gauge interest, based on what people need. Like if there's a lot of interest, then she wasn't going to try to do a 13-week thing, so she could make sure people could, that everybody could have access to it. And she's had pretty good response. And because, so we have, she's limiting it to 4 people, 1 for the social distancing piece, and also because those are the number of laptops that we have available, because there's going to be some work online that they need to do. But yeah, I mean, it's definitely something. Stacy's really interested in it. She's really excited about it. And so if everything goes well, then yeah, we're absolutely going to continue doing it and, and keep developing it. And to my knowledge too, and I don't know all the details, I know that Full Circle at some point was talking about putting together like a citizenship center. And so, and Stacy is, in communication with Carla, because she was the one, I think, working on that. So yeah, we're definitely tapping our partners, to get the word out and make sure everybody has, access to all the resources and all of that. So yeah, that's kind of where things are at right now. And I can keep you posted, like as we kind of go along. So
yeah, no, I think for me to consider your request on the staffing to support and make sure that some of those certainly the existing programming that has been developed, kind of goes off without much interruption or hitch, or can touch and serve as many folks in the community as possible, is a big priority.
Yeah, and those classes are going to be in the evening too, which that's also another consideration that so that'll affect Stacy's schedule as well and her availability in the library.
Mm,
So.
Okay.
Okay, so
Thank you.
so I guess you and I will follow up next week. It sounds like.
Yes, I will. I'll reach out to Lori and you will put something on the calendar.
Okay, that sounds great. Thank you.
Yes.
Thank you so much for your time today, Brenna and Jen. We
Yeah.
really appreciate it.
Yeah. Thank you.
Awesome. Is there anything anybody else has to share before we adjourn today? No? Chris, Amber, Beth, do you guys have anything that you'd like to add?
Kayla, this is Amber. So I just, I thought I might bring this up just for you and Sarah to start thinking about, because I was listening to Brenna talk about having to reduce her hours, and we're in a similar situation at the Aquatic Center because we've had to restructure our staff. We are also closed on Sundays, which historically we have not been. And so I think going into the 2021 budget, I mean, I think we're all likely to have some kind of reductions, and we probably need to start thinking a little bit, I know budget's still a little ways off, but about how we might address that and how we might decide which hours or buildings or services to reduce and how we're going to communicate that with the public, because I'm not sure it's going to be avoidable at some point in time. So
Yeah.
that's all I could think about the whole time you guys were talking, is how are we going to handle this going forward and how are we going to communicate this to the community? So just something maybe we should start talking about.
Yeah, no, I absolutely appreciate that, Amber, and I think that I don't know that right now we can anticipate facilities necessarily being open 7 days a week. So yeah, I appreciate you bringing that up, but we will, there's got to be compromises in places, and it's just, we can't do certain things to our fullest extent right now.
Yeah. Thanks, Amber. I appreciate that. I think that's something to take into consideration when we're going through those budget conversations. So I know that Crystal's going to be out next week, but the week following, we'll set up some time with her to start at least having those conversations of things to think about with budgeting, so that we can remember to take those department by department. All right, and nothing from Chris today. Nothing from anybody else today? No? Colleen, you good? I think so.
I don't have
Yes,
anything.
I'm good. Sorry, I am good. Took me a minute to unmute.
Okay. All right, Commissioner Mudge, do you have anything else this afternoon before we adjourn?
I don't. Thank you.
All right. Thanks everybody for your time today and your productive conversation. I really appreciate it.
Yeah, thanks you guys. Have a
Thanks,
good
Kayla. Thanks, Sarah.
Thank you.
Thanks. Have a great day.